Today's event is our final art and medicine event of this academic year and continues our mission of aligning the work of artist patients with the core medical school curriculum. This is the reproductive system that our students are studying now. And we do these events in order to foster enhanced understanding between patients and future health professionals. I'm really excited about today's conversation that promises to be as much about storytelling as about art. And I want to note that after the conversation, we'll have time, I hope, for questions. And for those of you on Zoom, welcome to you. And I hope to be able to field some of your questions as well. I want to introduce Dr. Erica Wright, who's the Associate Director of the HEAL program and of the Narrative Medicine program. I forgot to tell you who I am. I'm Pam Schaff. I'm the Director of those programs. And Dr. Israel, if she can join us, is an Associate Professor of Obstetrics and Gynecology. And I'm going to introduce Ted Meyer now, our artist in residence, who will take it from here and introduce our artist.
I would like to introduce our artist. I'm not sure the exact pronunciation of your last name, Rachael.
Jablo.
Jablo. Okay, so for anybody who wants to get into reproductive medicine, I grabbed endometriosis as sort of a main subject, and it affects a lot of women. 10 to 11% of women, 15 to 40. So let's talk about your book. Where we first met, we had a show together. You had a book called My Day of Losing Words, because you had had a migraine for 4 years.
At that point, it's still, sorry. At that point, it was 4 years, and now I still have chronic migraine. And I did the book because I was put on medicine that caused me to forget words, which I'm still on. And so if you see me stop and stare off into space, that is because I am searching for words. So, yeah.
So you were telling me that project, the idea of telling your story, led to this project. So why don't you talk a little bit about the transformation of learning about medical narrative, and then a little bit about your health situation that all led into this project?
So I got my period when I was 12, and around the time I think I was around 14, it got to the point where I was missing school every month because I was in pain. And my mom thought that was normal because that was her experience. And it was just, you have painful periods. That's what happens. And eventually I was put on the pill, and I kind of masked everything. And when I wasn't diagnosed with endometriosis until I was 42, when I moved to Germany, and at some point I passed out, and my husband was like, "You got to go to the doctor." And I thankfully finally was.
Passing out's a good time to go to the doctor.
You know, it was not my first time though. And I had gone to the doctor numerous times before that in the States, and had just been told time and time again, everything you're experiencing is normal. And so after I had surgery and I still was in pain, I was thinking about this sometime during the pandemic. And after I'd been fired by one of my doctors for asking for a second opinion, and I made my self-portrait uterus, which is in the show. And I started talking to other people about their experiences, showing them my self-portrait, and they started telling me their own experiences. I started making other people's portraits, other people's uterus portraits. And at some point, I realized that because I'm a visual artist. At first, I was mostly interested in the the visual aspect of it, like representing something that in a lot of cases is not, like endometriosis is not often, you can't see it on scans. But at some point I realized that the stories that they were telling me they were as important as the visual representation. And so I started recording them, and I applied for a grant, in which thankfully Germany has a lot of money for arts. And that became as important for the project as the collage themselves, and was able to create an archive. There's a website archive of all of the stories that's searchable, and so that people can see where, look up how their stories compare to other people's. And I'm not sure if that answered your question at all.
It does. So for any of you who haven't been in the gallery yet, all these portraits are there, and there's 2 books hanging on the wall with all the stories, and you can also go to the website. So a lot of the stories, a lot of the reason you got into this is because the people were not always listened to. So we don't want this to be a gripe fest of like doctors aren't listening, but what we'd like is what you learned doing this project about listening that maybe the first and second year students can use as they are dealing with their patients. So like we had a day the other one we were hanging, and there's about 60 of these hanging on the wall, and you had to take one out because there weren't magnets for it. And I could see you were really struggling because you have a very personal connection with every single one of these stories that you're depicting up there. So why don't you talk about how these med students can really listen to their patients, what you learned by listening to these 60 or 70 people from all over the world.
So one of the things that has really become apparent to me is that first of all, there are still a lot of taboos around illness, around menstruation, around just all of these topics. And when we go to the doctor, we only have 5, 10, 15 minutes. And when we talk to friends or family about our illnesses, we're usually we're talking in generalities. We're talking about, I have endometriosis, I have adenomyosis. We're not talking about our experiences. And so what I was doing with my storytellers was I gave them the opportunity to really share the full narrative of their bodies. And so sometimes people start in childhood, and sometimes people were sharing, about trauma. And they're almost always sharing about trauma, but, more than just medical trauma, about abuse and all sorts of things. And you really have to be able to be present to hold space for that kind of thing, while also keeping a little bit of distance. And I worked with a therapist to figure out how to do that and not let it overwhelm me.
Okay, so first, what was your process? Because I know you have people represented from all over the world. So how did you do a call for stories, first of all?
Most of this was done via social media. I would reach out. Sometimes people would come to me, but oftentimes I would do searches for whatever ailment I was interested in. And I would reach out to people and say, hey, do you want to tell your story? Because on social media, people are in some ways telling their stories. So I would ask people, and if they were interested, then I would tell them about the project. I have a consent agreement that tells them what I do with their data and how it, because everything is anonymous. And then we set up a time to talk via Zoom, and I record the call, and then I have a transcript made of it. And once I edit that, I send it to them to be approved. Once they approve it, then it goes up on the website, and I make the portrait.
Just going off again of the process. So, and that idea of how you're listen but also keep some kind of distance so that you can really take that story on. Do you think that maybe your artwork, or when you're listening, are you thinking about how you might create the portrait? Is there like that interaction in the moment between the art and the words?
Not usually until afterwards,
Okay.
because I really have to be present with someone when they're telling their story. I think that's just only fair. I mean, occasionally, if someone's story is something I've really never heard before, then there's somewhere in my head, then I'm thinking about possibilities or problems. Like just recently, I talked with someone. It was the first person I've talked to with vulva cancer, and the way I've chosen to do all of these portraits, there's no vulva, and so now I'm kind of like, okay, well, I have to refigure what I'm going to do.
Yeah.
But
Do we have some images? Oh, okay.
So here, let me borrow the mic for a second. So I'm going to go over the three walls, and you can sort of explain what's on each wall. And maybe you could point to one or two of them and explain how you differentiated them by, different color backgrounds, different.
this wall is on this side, it's endometriosis and fibroids, like together. And the one on the far left is my self-portrait, this vertical one. In the middle, underneath there's the definition of hysteria. And underneath that is undiagnosed people, which, again, like so many of us end up undiagnosed for years. And so I would really like to have more people who are undiagnosed. And on the right, it's people with fibroids, just fibroids. This wall is endometriosis and adenomyosis. And then right on the left, there are these two on the bottom left are two women with endometriosis and gynecological cancers. The one on the bottom is cervical cancer, and the one above that is endometrial cancer. And then the little spots on the wall between the uteruses are endometriosis lesions, because endometriosis happens mostly outside of the uterus. And then this wall is rare diseases and cysts. On the left, there's someone with endosalpingiosis. There are a couple of people with MRKH, including someone who had a uterus transplant, and her story is just phenomenal. On the right, these are a bunch of people with either ovarian cysts or PCOS. So, and right in the middle is someone with nutcracker syndrome who got misdiagnosed with adenomyosis and ended up having a hysterectomy because that is what happens when you have a misshapen uterus.
Do you want to share a few of the stories? It sounds like one thing that's so interesting, and for physicians in terms of listening. There's a sense that there's a, collection of similar cases, but they all have unique stories. And maybe you can talk a little bit about that.
Yeah. Actually, I think the first. So, Christina has endometriosis and adenomyosis, and one of the interesting things was she was one of my early storytellers, and I sent her the prototype of the website, and she sent me a message and said, I read someone, and it was before I think I had her story up, and she said, I read someone's story and I thought it was mine. And she just was completely floored that other people's stories were so much like hers. And I've heard that so many times. And actually, my mom kind of did the same thing. I said before that, my mom thought everything was normal. And then when I sent my mom the website, she read through a whole bunch and she called me and was in tears and said, oh my God, I thought all of this was normal. And she'd gone through her entire life.
Do you think that's a generational?
I think it's still going on. And one of the things that I do see is in talking to younger people is that they don't put up with this bullshit. Sorry. Is that because of there's so much more information out there now that they are able to self-diagnose, which as much as everyone talks about Dr. Google, at least, there's information out there that I never had.
So before you tell some more stories, I mean, your motto, I'll say on your description of this, was listening is activism. So how has listening activated you? And once you get all these stories together, how are you gonna make sure they live on as an activist statement rather than a one-time art project?
Honestly, doing this. I mean, having had the experience of working with you and showing my Days of Losing Words at UCLA, I knew as I was creating this that I wanted it to be a teaching tool. And so I'm trying to figure out how to bring this to medical schools, and I want this in front of medical students. I want people to learn from our stories. And because, our...
Is there, can you get it out on social media? Are there groups on social media, things where you can promote it?
I'm trying to do that. I'm doing a workshop at NYU in the fall, and I'm meeting with UCSF and while I'm in San Francisco, and I'm hoping to start to work with people. Yeah.
I was just going to go back to the art a little bit to think about, so the narratives felt very familiar to a lot of the folks, but each piece is different. And so I'm wondering if you could talk a little bit about how the visual representation helps to kind of get at that individuality and uniqueness, even as the stories are shared.
It was important to me to honor people's experience because there's a lot of shame. There's a lot of, there's so much pain that we go through, but just, I wanted something that really honored just our lived experience. And so even though there's a lot of similarities to all of the endometriosis pieces will look similar, and the fibroids will look similar, but I make each piece individually, and I reread the stories as I make them to make sure that I don't miss anything. And I really think about the storyteller. And yeah, one of the storytellers said that it was kind of a blessing that she now thinks of this beautiful object instead of just pain when she thinks of her diseased uterus.
One thing we got to chat about in the gallery, which I thought was so interesting, were the challenges with the undiagnosed stories. And maybe you could talk a little bit about that, because I think the idea of listening in that clinical encounter when there's not going to be a clear kind of path for diagnosis and treatment is maybe a little bit different or a little bit more challenging. And that could be helpful to hear your perspective on listening to the undiagnosed story.
Well, honestly, I think just because something is undiagnosed doesn't mean there's nothing there. And one of my storytellers bleeds a liter of blood every month. And that's not normal. And her doctor didn't believe her. She measured it, and and I feel like so often we are told that when a doctor tells us that whatever we're experiencing is normal, that we believe it because the doctors know they're the experts, but they are not the experts of our bodies. And another one of my storytellers, her doctors didn't believe it until she literally bled all over the doctor's shoes. And we need, just because they can't see it doesn't mean it doesn't exist. And so bearing witness to someone's experience is important.
Yeah, I think there's such a challenge between, on the one hand, we want it to be normal. We don't want there to be a problem. So we're kind of looking for that comfort sometimes. Mm-hmm. But at the same time, when we know, we want to be seen and heard. And I think that's really the complicated part of medicine that we can talk more about, that where the listening and those tools can help everyone, come out of this with a better understanding.
I mean, we've got first and second year students here, and more of them are going to watch this video. What can you say to them about just admitting, I don't know?
That is, my God, yes. There is such a huge comfort in having a doctor say, I don't know. It's unnerving, but it's also just an acknowledgement. I would much rather hear that than be told that your whatever horrible physical experience you're experiencing is normal. Because
you're not crazy.
Yeah. So much of this project has been about this just constant gaslighting. Passing out at ovulation is not normal. And, but I was told that it was for literally decades. And, bleeding a liter of blood, not normal. And like, we should not be told this. And just because a doctor can't figure out why it's happening doesn't mean it's normal. Yeah.
You have something, or should I go to the next slide?
Go, yeah.
Okay, so you haven't talked about this one yet.
This is Maria, and yeah, she also has endometriosis and adenomyosis. She was diagnosed with bipolar disorder. And this is actually, I think Christina, the one before, was diagnosed with anxiety. And
Hysteria.
yeah, like that's the thing, is that the hysteria thing is very real. We're kind of told that we're crazy. And being diagnosed with bipolar is not all that uncommon for people with endometriosis. Because we're just told, oh, we can't figure out a physical reason for your pain, so it must be in your head.
Go to the next.
And this is Alicia. She had I think it was 23 centimeter cyst that was cancerous. And she kept on going to doctors and kept on being told that she was okay until she collapsed in pain and ended up waking up like a couple weeks later, I think. Like she ended up in the ICU and had a hysterectomy. And she is Black. And when after a hysterectomy, she had to relearn how to walk because she'd been in the ICU for a while. And she went to her primary care physician and was not given painkillers and was given a lecture about the opioid crisis. And so, like, there are issues that have come up. There's many of my storytellers have dealt with medical racism, and these are all things that have not surprised me, but kind of broken my heart. Kiara is one of, again, these young people who, I think she might have been the one who went through menopause at the same time as her mom because she was put on Lupron. Lupron being a drug that just shuts down all of your hormones.
So you had this migraine for 4 years, and you have pain from this, 15 years.
15 years now.
Okay. And you have pain from this. Maybe you could talk about the difference or similarities between the two. Because, you know, people are always like, pregnancy, they always compare pain to how much it hurts to have a child. So why don't you compare endometriosis to a migraine, continued migraine, and how it affects your thought process. Like you were saying, you were doubled over, you fainted from this, but you couldn't think straight with the migraine. So
they're connected because I get hormonal migraines, and so like it's really hard to separate out one from the other. It's like chopping off a piece of my body, you know, like I still have migraines all the time. I have chronic pain all the time, and both kinds of pain are mostly under control, but I don't know that I would be able to say like I would rather have one or the other because they both suck. But yeah, I don't know. It's a kind of weird question, and I don't think I can answer it.
Well, maybe we can have some less weird questions if anyone has comments or questions.
Can you come down for a second?
Oh, wait. Are you okay with that?
Totally okay. Right?
Okay.
A little surprised. Dr. Isabel's on the way too.
Oh, okay.
She's stuck in clinic. Is that all right?
Yeah.
Yeah.
Are you
Yeah. No, I just, you know,
Well,
the
you
whole
were-
point of the project is that it's anonymous, and so.
okay.
All right, you can have the chair for a sec. Why don't you talk about being part of a project like this and actually getting listened to?
I'm one of the uteri. What's the plural? Uterus?
Oh.
What's the plural of uterus? Anyways, I'm up on the wall. It meant a lot to me. Actually, I just had a little freak out because when I was sitting there, my migraines are hormonal, and I keep trying to get people to talk to me about that. And they just want to deal with them as separate entities.
Yeah.
And I only started getting migraines in my 30s. It was very strange. And it took a while for me to realize what was going on, but I still can't get people to talk to me about the connection between the two, except that sounds really hard. But I got to see my uterus today in person versus a photo, and it's beautiful. And it means a lot to me to see all of those stories. I've looked at your website and I've been posting about it as well, because I think a lot of people are ashamed to talk about it. So I'm really glad that it's up there, because I did feel ignored and it was really challenging. And it still is like this weird period of my life where I could get more fibroids, they could come back. I might have to deal with it then. I don't now. I'm grateful. But the whole process was really challenging. So I'm so grateful that you're out there, and I hope more and more, because it's definitely, we're talking like I have issues with it. My mom didn't talk to me about it. And then as I started to have problems, she talked to me more about it. And my older sister has problems. And we all just kind of like struggled through it. Yeah. Thank you.
Thank you. I know I heard you guys talking downstairs and you seemed so excited about it. I hope it's okay that I called you. Yeah.
Ted, there's a question in the chat too that I can read.
Okay.
The student asks, she was wondering how these artworks were created. Are they based on actual ultrasounds or other imaging studies, or are they imagined based on the patient's stories? And she just would love to hear about color choice as well.
No one has sent me their actual imaging. And honestly, I wouldn't know how to read it. I don't have that ability, but they will often give me, like, if they had surgery, they'll tell me if they have fibroids. They'll say I had a submucosal fibroid on this side or whatever. And sometimes they don't know. With endometriosis, it's often more general because especially because, half the time it's in different areas of the body, and I just made the universal decision to not show other parts of the body. But so I'm making it up as I go along, and the color decisions are completely out of my imagination. So the actual works are made of cameraless photographs of lace, and I start in a color darkroom, and I use pieces of lace in place of a negative, and so I'm enlarging that and then cutting those up and collaging them, and then putting them on a metal leaf background. And so I have like a collection of prints that I've made, but, they're not, I don't make them to look like body parts, I use lace because it's something that I think of as made by women for women. And, but yeah, the colors don't correspond to anything.
You did mention when we were talking, the background colors have significance. So.
Yes. So the metal leaf backgrounds, they correspond to the participant's gender. And So the gold is are cis women, and there's some that are a sort of copper multicolored, and those are non-binary people. And then they're right now I only have one that is fully silver, and that's a trans man.
So it's interesting. Normally we show artists here who they just do their work. Like your migraine book was about you. Was there a certain point where you just went, this is a bigger issue, or it's so universal, or like what made you decide to expand this from yourself to everybody else?
Well, I had done my self-portrait, but there's only, I can only do one real self-portrait of my uterus. And it was more interesting to me to do like a whole series about other people and their diseases, their disorders. This is definitely the first time that I've dealt with other people's stories and other people's experiences, but our experiences are kind of universal, just in dealing with medical issues, especially these kinds of medical issues. I don't feel like my story is not in the archive, partly because all of the stories are anonymous and I can't be anonymous in my. Yeah. And, but my story is the same as Christina's, is the same as Macarena's, all of our stories are the same. In so many ways. I mean, they're all very individual, all very specific, but I didn't feel the need to put my own in there because I have right now, like 65 others.
Okay.
I'm Jennifer Israel. I'm one of the gynecologists here, and I am so sorry for being late. But just hearing the stories that are being told, I'll sit down if that's okay. And thank you all for sharing, because I know these are all very personal and private and difficult stories to share. And one of the things that Dr. Schaff taught me, I was one of her ICM students when I was a first year, and I still carry with me, is that you have to listen to the story. And there's so much in the stories that our patients tell us that we have to listen as if you were listening to a friend or a family member. There has to be some, there have to be boundaries, I understand. But if you just listen, there's so much to be told. And no story is unreasonable or irrational. This is what our patients are feeling. And what you're sharing, I didn't quite hear the last part about, there was a question?
What is the solution?
What are the solutions?
No, what is the solution?
The solution? So I'm a firm believer that your physical health is only one component of your body. We are our minds, our spirit, our physical being, mental, emotional being. And if you're not healthy in any one of those components, you're not healthy. So as doctors, we're not here to just help you with the physical. That's what we're trained to do. That's the science. From a medical perspective, we encourage our patients to incorporate it all. Like, I'm not experienced or trained in chakra, although my daughter is, and I listen to her. I'm a believer that whatever your spiritual being is, whatever that connection is, use it and incorporate it. And as providers of healthcare, we encourage that. We want you to be physically healthy, do all the things that will help you improve on a scientific and physical level, but everything else has to be part of that.
I can use this. Thank you so much, Dr. Israel. And thank you for coming after a busy clinic. I'm afraid we're out of time, but I want to thank everyone for being here. Thank you, Rachael, so much for sharing your work
Thank you for having me.
and your activism. I want to make a quick note that I actually saw an announcement about your work on a Health Humanities listserv conversation.
Oh, yeah.
So people are talking about it, and it's getting out, which is really important. Thank you for sharing as well. And Ted, as always, thank you for facilitating this conversation, and Dr. Wright for being here as well for the conversation. So thank you.